I love coming to work. I love working with the patient population that we work with and just bringing new life into the world, supporting people when they're at their most vulnerable. The most challenging is probably when you have a patient that's experiencing a loss. That can be very difficult. It's a hard time for them, and you want to make sure you're giving them all the support that you can possibly give them and all the help that they need. I don't always work with those specific patients, but I do behind the scenes stuff like staff education and making sure policies and procedures are up to date so that we can, again, support them in the best way possible. I was very surprised and excited, obviously, but yeah, definitely very surprised.
I enjoy seeing people happy. The hospital really is not a place that people really think about that. And while patients and families are here, I just like to prove to them that it can be a place of healing. And I like to really promote that quality care in actions because I feel like actions speak louder than words in this field. So I was kind of caught off guard. I mean, I've been in the bedside care for 16 years. So for being a nurse for a little bit over a year, all that experience as a CNA really kind of jump-started my compassion toward individuals when I started as a registered nurse. So it's very nice to be able to take deeper care of people than what I previously was doing.
So I've always wanted to take care of people. I've always felt the drive to be in the geriatric population profession. We work with a lot of dementia patients here, and sometimes the behaviors can be quite challenging, and I find that very rewarding when we get a good outcome. I really get a chance to connect with patients and families working here in the clinic, and I also find that very rewarding. I've been here about 27 and a half years, and working for the Mayo Clinic Health System has been just a blessing. I'm excited. I think it's a grand gesture. I was surprised by it. I have worked with Roxanne for quite a few years, and she is a great person to work with, so I thank her.
Did Roxanne nominate you?
Yes.
Okay.
Decided to become a nurse because I wanted to be able to work with people. I like a hands-on being at the bedside with patients and working with them, and wanted to be able to give back in some way. I was very grateful and actually kind of humbled by finding out that I was nominated for this. I had started taking classes at UW Richardson Center in 2010, just general classes, and during that time I took some aptitude tests there, and it was identified that healthcare field may be fitting for me. So from there I began taking prerequisites at Western Tech in La Crosse. And then the schedule opened up for me to attend the actual nursing program at Southwest Tech in Fenimore, and that was where I completed my nursing degree.
When I was younger, I had an experience of helping my mother with a friend of a friend of a friend, and the exuberant amount of joy that this person got just from us helping her do the littlest daily tasks really drove my drive to become a nurse, to help people. Over the last few years of being a nurse, I've learned that helping people can mean so many different things in so many different ways. I think at the end of the day, we wear so many hats. The most rewarding thing is to help a patient through a really difficult time and see them be successful at the end, and just have them have that sense of accomplishment. I was definitely honored and flattered. It's something that nursing is very passionate to me. For as long as I can remember, even previously to working in acute care before coming to rural healthcare, just trying to be the best nurse that I can be for my patients in whichever time that they need to be or need to be is something that I just strive to do daily, and it's just really neat to see that somebody had acknowledged that.
I would have to say that I find just making people feel better at the end of the day is rewarding. It's nice. It's a nice compliment. I appreciate it.
What motivates me to work with the elderly and work in geriatrics is just all the love that you get from them. These are members of our community. They raise children, grandchildren. They worked in all of our businesses, and it's really just an honor to go there every day and be able to spend that last chapter in life making their lives better and making them more comfortable. They really are some of my best friends. They really are, and the time that I get with them, I cherish. I really do.
When I started my career, it wasn't very much known. I think Katie Couric was the first one that kind of on air started doing the colonoscopies, and that kind of got the word out, I think, or helped get the word out for a lot of people. And since then, obviously, we've done a lot better with advertising and letting people know the importance of colonoscopies and different testing. But they do save lives. You know, people come in for sometimes screening colonoscopies and find things that they weren't expecting. Yeah, so a lot of people think if you have a symptom, then you should be tested, but it's not the case. I mean, sometimes something can be brewing in there for years and years until you have a symptom, and then a lot of times it's already, later progressed. So it's important to have these tests before you have symptoms. So, getting in and they just moved the screening age down to 45 to catch some of those that were getting missed because people are getting colon cancer at younger ages for whatever reason. I personally have had some of my classmates already be diagnosed with colon cancer. And I'm from a small town in Arcadia, so having 3 people in a class of 70 is a lot. I mean, that's a big percentage. So it's very important to be tested because you just never know at whatever age. So we do know that they run in families. So, we always ask, like, do your mom, dad, first degree relatives, have they had polyps? And then if you find that you have polyps, you want to tell your first degree relatives. And then it's usually 10 years before the first person that's diagnosed. So if you're finding colon cancer or colon polyps at 35, potentially your children are getting theirs at 25. So it's very important to know family history. A lot of people they don't talk about that, but it is very important to find out that information. Well, just a lot of people don't talk about that kind of stuff. And I don't know if it's being a nurse or just my personality, but I'm not afraid to let everybody know that they should have a colonoscopy, and you need to have one. Well, I do think it's catching up. I mean, I think, even the commercials are talking about the different things like the Cologuard, the FIT test. I mean, definitely there's a lot more awareness for the importance of colonoscopies and catching this stuff early before it becomes a situation or an issue. So, I think there's a lot more things available to people, different options, which they didn't have before. I do know, like, our age parents, you didn't talk about your health care. You didn't, if you had cancer or you had some issue, you would just not talk about it. Very private. And I feel like as the generations go, they know the importance of sharing health history and letting people know so that they can get their preventative care. So I do think that's helped too, because people aren't afraid to share that information.
The patient experience that is most memorable, I think, in relation to organ and tissue donation is when I was a nurse on the critical care unit. I was actually taking care of a very severe neurotrauma patient. The patient was in our unit for multiple days, and I had been taking care of her, had got the opportunity to know her family, her mom and her dad, had the opportunity to have a couple of her siblings come in, really take a lot of care with this patient. And tried very, very hard to provide the best possible outcome for the patient. Unfortunately, that was not what occurred, and this patient became eligible for donation. The way our system functions is we have a donor resource team, which is a group of nurses that are specifically trained to take care of those patients. One of the things that I found that was kind of a void or a gap for me was that when it came time for this patient to transition to the donor process, I was removed as the nurse and one of the donor nurses came in. And so that was something that really motivated me because I had built the relationship with the family. I had kind of become attached to the outcome that this patient had. And so then to be pulled away or to have somebody else to step in to kind of fulfill that role really led me to pursue that passion. And so I became part of the organ and tissue donation resource team as a bedside nurse. And then when I became a manager, I actually got the opportunity to become the liaison for critical care, or the liaison for Gunderson, and really lead that critical care donation resource team. And so it's something that I'm very passionate about. It's something that I take very, very seriously. It's something that as a team, and by a team I mean our providers, our nurses, our techs, and then the teams that we partner with UW, we all take it very, very seriously because the outcomes of donation can have such an impact on people. It can have an impact on the donor families because it gives them the opportunity to see something very good or positive out of a situation that normally comes related to trauma or high stress situations. And so the fact that they get some closure or some good out of that really gives them that opportunity, but then also has such an impact on the recipients as well. It can change their life, it can change the outcome or the course of it. It gives them the opportunity to do things they may have never thought that they could do again, and it just is so rewarding. You can actually go to Donate Life Wisconsin